what if I was exposed to someone who tested positive for COVID? What do I do? So I'll start with Lisa.
Okay, so each province does this a little differently in the numbers you call or the specifics, but the take-home message is if you think you were exposed and you don't have any symptoms, the instructions right now are to stay at home and self-isolate. And the reason that's important for both you and for people around you is obviously all the things we've talked about. The question around if you're immunosuppressed, does that change? Are you more likely to suddenly get really progressive or really fast-moving symptoms? We don't know the answer to that, but we don't think so far. And so staying at home. If you do then get symptoms, it's exactly sort of the same as we tell other folks. Fever, and I'm hoping most folks at home, especially if you're on a significant amount of immunosuppression, have a thermometer at home, hopefully. If you do get a fever, which is greater than 38 degrees Celsius, or you develop a new cough or a worsening cough, if you always have a cough, please check in with your local public health department. Sometimes that's 811, sometimes it's a different number, and see what they advise you to do. That will depend on a bunch of things, whether you've traveled, how close the contact was. They'll give you some really good advice about seeking medical attention. I always tell people, make sure you tell them that you're immunosuppressed, because the advice today is that unless you have symptoms, we're not swabbing people or testing people too often. The test is a nose swab that goes into the, one person told me it went to the back of their brain. It does not go into the back of your brain, but it feels like it. It goes pretty far back there. That's the test. Right now, we're telling people if you don't have symptoms, you don't get tested, even if you're very high risk. That may change over time if we notice something that makes us think there's more spread than we expect, or there's a lot of community spread. And so right now, reach out to public health. They are amazing. Their information sites in all of the provinces are very good, as well as the Public Health Agency of Canada, and they'll tell you where to go next to get the right help and assistance. If you feel acutely unwell, you can't breathe well, or you feel like this is an emergency situation, you call emergency or have someone around you call emergency. And I always say, give them the heads up that you have some respiratory symptoms. So EMS or emergency medical services is prepared if they come towards you as well.
And I have to say, Lisa, just a point that if you need the number for the public health officials in your province, that is on the guidance document on the crohnsandcolitis.ca website. There is a link to the numbers for each province, so you can get that there.
Amazing.
Lisa, just to add one thing and to ask you a question is, and I don't think we talked about this, is a little bit about the incubation period, which may be relevant to this question, where if someone has been exposed, because we've, I think, heard and seen somebody, they've been exposed, they start to isolate themselves for 5 to 7 days, they don't get symptoms, and then they feel that they can come back into sort of out of self-isolation. Can you just sort of speak a little bit and sort of stress the time period there, in your opinion?
So the original guidance was that if you thought you were truly exposed to someone or you traveled from somewhere, that you put yourself in self-isolation if you were asymptomatic, meaning had no symptoms, for 14 full days. Some of the provinces are starting to think about changing that a little bit to shorter, but right now, given that we're on the upswing of this curve, right now, 14 days is the maximum you would stay in isolation. Sometimes you hear when you're on immunosuppression that you may shed virus longer. If we're talking about other viruses, sometimes you can be shedding virus if you're on a lot of immunosuppression for longer than some other people. We don't know the answer to that right now with this virus. And so whether or not you should stay isolated longer, probably not. But I would suspect if you're on a lot of immunosuppression for your illness, that it's probably not a great idea to go on the shorter end of things at this point. But at the end, if that's the end of your 14 days, you're symptom-free, the guidance is that you can go forth and stay home again, because everyone's being told to stay home. So you don't get a get out of jail free card there. Unfortunately, we're all being told, unless we have to leave our homes, to try and stay in the same place. But to your point, 14 days, up to 14 days is the incubation. We think it's probably an average of 10 to 12, or not an average, but a maximum of 10 to 12 days, with an average closer down around 5 to 7.